Hi, my name is Dr. Philip Miller. I'm a facial plastic surgeon with a rhinoplasty practice here in New York City. I'd like to speak to you today about Asian rhinoplasty. Asian rhinoplasty is characterized by changing the shape of a nose which typically on profile is somewhat low, it's somewhat flat and closer to the face. And the starting point of the nose is a little bit lower than you might expect in a Caucasian nose. It's a little bit lower here than what you would expect or what you typically see in a Caucasian nose higher up. The bridge on profile is not always flat, as I mentioned. It sometimes appears as if there's a little bit of a bump, and that's because on profile the tip of Asian noses is often a little deprojected or closer to the face, giving the illusion of a bump on the nose. From the front, the nose appears, again, somewhat flat here, wide both at the facial plane as well as at the alar base, or the base of the nose, and the tip itself. It appears wide and short and, as I mentioned, somewhat flat. The underlying structure of the nose beneath the skin, the bone and the cartilage, are relatively wide. The nasal bones are short here. The cartilage is a little bit longer in the mid-third and the lower third, and it's very weak. There's really not that much support at all. And what this would require, therefore, in most Asian rhinoplasties is building up the nose and actually adding structure, not so much taking it away, but adding structure. Asians request a spectrum of changes ranging from the subtle, just a little narrowing of the base, to a little bit more obvious changes, such as adding volume to the bridge, giving a more prominent bridge, a narrow, projected and defined tip, or a very narrow facial plane or alar base. I spend a considerable amount of time creating what I call a unified vision, so that the patient and I can be sure of what they want as a desired outcome, either from a subtle change, almost imperceptible to anyone other than the patient's immediate family, to the more extensive changes that really transform not only the nose but also enhance the entire face. After all, the goal of rhinoplasty is to make a very attractive, good-looking face, not necessarily making just a good-looking nose.